with us, but we want to make sure that you get this information down, or get the information, period, because we know retiring through the district and then becoming Medicare eligible, or becoming Medicare eligible before you leave the district, can be so confusing. And so we don't want you to continue to be so. And hearing this information the first time, the second time, sometimes requires that you hear it again and again. So with that, I am going to now turn the mic over to a young lady that I'm so happy that Sunny Smith with Kaiser introduced me to indirectly. She is with the Social Security Administration. She deals with Medicare questions all the time, especially around enrollment. And we're going to turn the mic over to none other than Theresa Campbell of Social Security Administration. Theresa?
Thank you to all of you for being here. So I have worked for Social Security for 30 years in both supervisory and technical positions. And the decisions that you make about your retirement, we're all going to make different decisions, but the decisions that you make are going to be some of the most important decisions that you make in your life. And so there's no right or wrong answer. We just want to make sure that you have all the information that you need so that when you're ready, you'll be able to make informed decisions. So this presentation is primarily going to talk about Medicare, even though in the breakout room, we can discuss how Social Security benefits are computed in the windfall elimination provision. But here primarily we're going to talk about Medicare. So Medicare is actually run by a different federal agency. It's run by CMS, or the Centers for Medicare and Medicaid Services. But you apply for Medicare at the Social Security office. And we have a lot of information about Medicare. So when you have questions about Medicare or need to apply for Medicare, you contact Social Security, because CMS doesn't have field offices. But Medicare has 4 main parts. Part A is hospital insurance. If you have your 40 credits, so if you have worked in jobs for at least 10 years where Social Security was withheld from your pay, or if at least Medicare was withheld from your pay. So if 1.45% of your wages went to Medicare for at least 10 years of your working life, then you should be insured for Medicare, and your Medicare Part A, or the hospital insurance, will be premium free. Part B is for doctor visits. There is a premium for your Medicare Part B. If you have Medicare Part A and Part B, then you have what's called original Medicare. So this is what everybody used to have before the HMOs and the PPO started, but you would have what's called original Medicare, and it covers 80% of your approved costs. Now, most people, once they sign up for your Medicare Part A and Part B, they choose to have a Medicare Part C plan, or a Medicare Advantage plan. So the Medicare Part C plans, those are the HMOs and the PPOs that are offered by private insurance companies. You have to have A and B before you can sign up for C. So an advantage to having your Medicare Part C is that almost everything is covered. So except for small copays, once you have a Medicare Advantage plan, it covers, almost 100% of your medical costs. The Part G, that's the prescription drug plan. You can sign up for a Medicare Part D plan as a standalone plan. So you can get A, B, and D, and then sign up for a G plan. But almost all of the Medicare Part C plans also include a Part D plan. Now, all of the Medicare Part C plans have been approved by Medicare. So they have to meet very stringent guidelines to be approved as a Medicare Part C plan, or as a Medicare Advantage plan. And by law, the Medicare Advantage plans have to cover everything that's under A and B. So there's a lot of advantages to having a Medicare Advantage plan. If you just have A and B, and you're in an accident or you develop a condition, then, you know, original Medicare only covers 80%. But some people don't want a Medicare Advantage plan. They don't want an HMO and they don't want a PPO. In that case, we would recommend that you sign up for Medicare A and B and D, and that you purchase a Medigap policy to cover that 20% that original Medicare doesn't cover. Now, those Medigap policies can be kind of pricey. So what we see, almost everybody, once they're eligible for A and B, they choose a Medicare Part C plan or a Medicare Advantage plan. So you might have heard that full retirement age is going up for Social Security, and it is. But that's not the case for Medicare. So Medicare eligibility is still age 65. Or if somebody has received Social Security disability for 24 months, they become eligible for Medicare. Individuals who have ALS can become entitled to Medicare right away without that waiting period. And individuals who have end-stage renal disease that requires dialysis or are going to have surgery for a kidney transplant can be eligible for Medicare to pay for the dialysis and to pay for the surgery without that waiting period. And they can even be eligible for it if they're still working, so they can get Medicare to pay for those very expensive procedures. Okay, so there's different enrollment periods for Medicare. And these are very important that we don't make a mistake on these, because if you make a mistake, it can really affect you for the rest of your life. So the initial enrollment period is 3 months before you turn age 65, and it ends 3 months after you turn age 65. If you receive a Social Security benefit, so maybe you're getting retirement, maybe you're getting auxiliary spouse, maybe you're getting a survivor benefit, then we assume that you want Medicare A and B when you turn age 65, because almost everybody does. So we sign you up for it automatically 3 months before you turn age 65. If you do not receive a Social Security payment, then we would recommend that you sign up for Medicare 3 months before you turn age 65. If you are not working or your spouse is not working and you do not have health insurance based on your active current employment, you're getting up and going to work every day, or your spouse is getting up and going to work every day, then Medicare is your primary insurance. And so you might have insurance through TRICARE, or you might have insurance through your retirement. But if you're not working, once you turn age 65, Medicare is your primary insurance. And we strongly recommend that you sign up for Medicare A and B during your initial enrollment period. If you are working or your spouse is working and you have health insurance based on your or your spouse's active current employment, that health insurance is your primary insurance and Medicare is your secondary insurance. So we would recommend in that case that you sign up for Medicare Part A during your initial enrollment period and you refuse your Medicare Part B. You have 8 months after you or your spouse stops working to sign up for your Medicare Part B, and there will not be a penalty. Right? Because if you're working, the insurance through your job or the insurance through your spouse's job is the primary. So we recommend that you sign up for the Part B then the month that you or your spouse stops working, but you have 8 months before you would be penalized. Now, if you've missed your initial enrollment period and you don't qualify for a special enrollment period, you would only be able to sign up for your Medicare Part B during the general enrollment period. That's January through March of every year. It kicks in July of that year, and there's a 10% penalty for every 12 months that you could have had Part B and you didn't have it, and that's a permanent penalty. Okay, so if you enroll in Medicare Part B 1 to 3 months before you reach age 65, your Part B coverage begins the month you reach age 65. If you enroll the month you reach age 65, then Part B kicks in 1 month after the month you reach age 65. If you enroll 1 month after you reach age 65, Part B kicks in 2 months after the month of enrollment. And if you enroll 2 or 3 months after you reach age 65, then Part B kicks in 3 months after the month of enrollment. Okay, so the standard premium for Medicare Part B is $148.50 a month. And that premium is deducted from your Social Security payment, and it's sent electronically to CMS. However, if you don't receive a Social Security payment, maybe you're going to hold off on your retirement because you want your benefit amount to grow larger, then you are billed quarterly for the Part B. Unfortunately, I got some kind of bad news about Part B, and that means that Part B next year is going up quite substantially. It's going up to $170.10 a month. So the cost of living is going to be a lot higher for next year than we've seen for many years, but our Part B premium is going up too. Now, some people pay less than this for Part B because they have limited income and the state helps to pay the Part B premium. But some wealthier seniors do pay more for their Medicare Part B. So an individual who has modified adjusted gross income of more than $88,000 a year, or a couple with modified adjusted gross income of more than $176,000 a year, would pay an additional premium for their Part B. And when we determine what the premium will be, we look at your income from 2 years ago. If you've had a life-changing event, and that includes a marriage or a divorce or no longer working or going from full-time to part-time, then we can go by last year's income or this year's anticipated income if it's more advantageous. Okay, so for Medicare Part A, if you have 40 or more credits, and the way that you get a credit is by working and paying Medicare tax. So working and 1.45% of your wages is going to Medicare, and you've done that for at least 10 years, because you can earn 4 credits a year, then your Medicare Part A is premium free. Now, let's say that you have been a teacher and you're going to get a STRS pension and you didn't pay into Social Security or Medicare. Then you can use your spouse's credit. So if your spouse has at least 40 credits, you can use his or her credits to get Medicare Part A premium free. If your spouse passed away, you can still use their credits for premium free Medicare Part A. If you're divorced, but you were married for at least 10 years, then you can use your spouse's credits to get Medicare Part A premium free. If you had between 30 and 39 credits, the Medicare Part A is $259 a month. Less than 30 credits, the Medicare Part A is $471 a month. So you can always create a My Social Security account, go on there and see how many credits you have. If you have less than 40 credits, it will tell you how many more you need to earn to get to 40. Now, let's say you have original Medicare. You just have Medicare Part A and B, then there are deductibles. The deductible for the Part A, before the Part A would start paying, is $1,484 a year. If you're hospitalized, the coinsurance from day 61 to 90 is $352. After day 90, from day 91 to day 150, the coinsurance is $704. If you're in a skilled nursing home, then Medicare will pay up until day 20, and then between day 21 and 100, the coinsurance is $185.50 a day. After day 100, Medicare no longer pays. A lot of times the Part C plans will include skilled nursing coverage, and a lot of individuals also buy insurance just to cover the skilled nursing. The Part B deductible is $203 for the year. Okay, so Medicare.gov is the place where you could go for information about what Medicare covers. So it's really very user-friendly. So you can just type in a condition or a medication, and it will tell you whether or not it's something that Medicare covers. Like you might say, you know, dental. Does Medicare cover dental? And the answer would be no. If you have original Medicare, for the most part, it doesn't cover dental. Or you might type in, a prosthesis and see, yes, Medicare would cover that. But then again, a lot of the Medicare Advantage plans will cover the things that original Medicare does not cover. Another agency that we like is called HICAP. Other states call it SHIP, or State Health Insurance Assistance. California calls it HICAP, Health Insurance Counseling and Advocacy Program. And the reason that we like HICAP is that, first of all, they can help you. They can help you navigate through Medicare. So Social Security will give you information about Medicare, but we won't advise you. We'll just give you the information and leave it up to you. But there are agencies out there that can actually offer advice. And also, if you have trouble with Medicare, let's say you have difficulty with them, you're disputing something, or you're having trouble with an insurance company, HICAP will act as ombudsman. Also, if you're looking at a great place to work after you retire, a lot of my colleagues who retire from Social Security go and become volunteers at HICAP. So it's very rewarding work as well to help people navigate through all this. So once you learn how to do it, you can show other people how to navigate through the health insurance for those on Medicare. Okay, now the first thing you want to do when you're planning your Social Security, your retirement with Social Security, because Social Security is going to be a large part of your retirement. Even maybe you don't have your 40 credits because you're a teacher and you didn't work at jobs where you paid into Social Security. A lot of people, they see how many credits shy they are, and they go out once they retire from their job and they work at jobs where they can earn those last couple of credits so that they can get to 40 and they'll be able to qualify for a Social Security retirement check. But My Social Security puts you, it gives you access to your own personal Social Security information so that you can plan for a comfortable retirement. And you know what to expect in the future. And then once you're ready to retire, you can manage your benefits online. So you don't have to visit a Social Security office. You can just manage your own Social Security from the comfort of your own home. Okay, so you can start to receive your Social Security benefit anytime between 62 and 70. The later you wait, the higher your benefit amount is going to be. So if you receive benefits early, if you receive benefits prior to your full retirement age, so our full retirement age is going up, right? And so for a lot of you, your full retirement age is going to be 66. If you were born 1960 or later, your full retirement age is 67. You can still retire as young as age 62, but your benefit would be reduced 30%, and that's a permanent reduction. Or you could wait as old as age 70 to earn delayed retirement credits and to totally max out your benefit amount. If you receive benefits before your full retirement age, the decrease is about 0.5% for every month that you receive early. If you receive past your full retirement age, the increase is 0.2% for every month that you wait past your full retirement age. Once you turn age 70, your benefit is maxed out. It won't be any higher, so don't wait past age 70 or else you're just missing out on your benefits. Okay, so if you have a smartphone or a computer or a tablet, you can create a My Social Security account. You go to socialsecurity.gov/myaccount and you sign in or create your account, and then you provide some personal information, including some out-of-the-wallet questions. To verify your identity, you choose a username and password, and then every single time you log into your account, we will text you or email you a security code. So that's an extra layer of security. Okay, so when you're ready to apply, you would need to decide, do I want maybe you're applying for your retirement and Medicare at the same time. You're within 4 months of being age 65. If you're younger than that, then you would just apply for retirement only. And then at 65, your Medicare would automatically kick in. Or you might say, you know what, I want my Medicare now, but I'm going to let my Social Security keep growing, and you can apply for Medicare only. We're going to ask you information about your work. So we're going to ask you to review your earnings record. That's very important because when we compute your benefits, that's what we look at. We ask you about your marriage's beginning and ending dates because we want to see if you could qualify for benefits on someone else's record or if someone else could qualify for benefits on your record. We ask you about tax withholding if you want us to withhold federal tax. Direct deposit, we would ask for your bank's routing number and your account number. You can sign it electronically, and that's it. It will take you about 10 minutes. Now, let's say that you went to ssa.gov, you signed up for Medicare Part A, and you refused Part B because you have insurance based on your active current employment. But you're going to retire, and you need your Part B now. There's 2 forms you need, and you can get these from the ssa.gov forms page. They're the CMS 40B and the CMS L564. The 40B is the form that you sign saying, I want my Part B to start now. The CMS L564 is the form that you take to your HR department. They complete it, verifying that you're employed or have been employed within the last 8 months and covered by the group health care plan. You take these to your local Social Security office, and we will sign you up for Medicare Part B, and you will not be penalized. The best way, because right now the Social Security offices are not open for walk-in visitors, the best way to get this information to us is to fax them to your local office. So you can find your local office fax number online, fax them in, it goes into our electronic work track system, and it will be assigned to somebody, and this is very easy for us. We'll have you signed up within a couple of days. Okay, so, the one thing that you want to do if you haven't done it already is to create a My Social Security account. Once you receive benefits, once you create your My Social Security account, you can get your proof of benefit verification letter, check your benefit and payment information. You can look over your earnings record, change your address or phone number, start or change direct deposit, request a replacement Medicare card, or get a replacement 1099 for taxes. If you do not receive benefits, you can create a My Social Security account to request a replacement Social Security card if you're at least age 18 and a U.S. citizen. Check the status of your application, get proof that you are not getting benefits, and then get your Social Security statement to review, including where you can do the Social Security calculator and put in different scenarios of when you're thinking of retiring and see how that affects your benefit payment. Okay, and mymedicare.gov, you can create a mymedicare.gov account as well, and that connects you to your own personal Medicare information. You would not be able to do this until you actually sign up for and become eligible for Medicare. But this is a great thing to do also to link you to your own personal Medicare information so that you can manage your record at home without calling Social Security or trying to get through to CMS. Okay, well, thank you for your attention, everyone. And I hope to see some of you in the breakout room. And if I don't, I hope that you have a wonderful retirement.
Thank you so much, Theresa. That was a great overview, and I know you're going to delve in a little bit deeper when you get into the breakout room. So everyone that's signed up for her, get ready. I'm going to now turn the mic on to none other than Kaiser Permanente's Medicare specialist. She knows about all the CalPERS programs and how Medicare and CalPERS interface when you're age 65 as an active or even age 65 as a retiree. So with that, I would like Julie Brady to take the mic.
So my name is Julie Brady. I do work for Kaiser Permanente. I often speak about Medicare and how Medicare coordinates with the various CalPERS plans. Of course, I believe almost all of the CalPERS plans have representatives here. So, any of your specific questions about those plans, you should address to them during the various breakout sessions. And Theresa gave you an in-depth overview about Medicare So I'm just going to shift a little bit into CalPERS and what you need to do when you are going to continue your health coverage through CalPERS. So the big takeaway here is if you continue to work beyond 65 and you're continuing to get employer-sponsored coverage, such as through CalPERS, you can go ahead and defer that Part B. So you would basically not be paying for Part B premiums because the coverage you have through CalPERS is primary to Medicare. So then you don't have to worry about that Part B late enrollment penalty. You fill out the paperwork that Theresa mentioned, the various forms, when you are ready, once you've retired, to enroll in Part B. If you are retired and you're 65 years or older, or you're turning 65 and you're eligible for premium-free Part A, meaning you've worked your 40 quarters or your 10 years, either paying into Social Security or just Medicare, and there's no monthly premium for Part A, you are required to enroll in Part A and then also enroll in Part B and make those Part B premiums. So your Part B premiums are either coming out of your Social Security check, or you're making some other arrangement to pay by check, by credit card through the Social Security website. This also goes for your spouse. So if you're retired, maybe you're under 65, but your spouse is turning 65. If you're covering the spouse needs to follow the same rules that you would be following. If you're under 65 when you retire, remember, you just stay on the basic plan that you have now. You don't need to do anything for Medicare until you actually become Medicare eligible. If your current CalPERS basic health plan offers a Medicare plan, you are automatically enrolled in that plan unless you make a plan change. So your retirement or your aging into Medicare is an opportunity for you to change plans if you want. Otherwise, CalPERS moves you into the sort of the connected Medicare plan. So an example of that would be Kaiser to Kaiser or Sharp to Sharp, et cetera. You do need to pick either a Medicare plan or a combo plan, depending on eligibility. So if everybody's eligible for Medicare, you pick one of the Medicare plans. If one of you or more is eligible for Medicare and one or more is eligible for the basic plan, so they're not 65, then you are picking from the combo plans. That's how CalPERS defines them. So basic is for actives and early retirees. Medicare is for Medicare eligibles, and then combo means you have some combination of basic and Medicare. You make your plan change or enrollment through CalPERS. You do not need to contact the health plan. You do everything either through My CalPERS or through paper or faxing in the information. And then CalPERS sends that electronically to all of the health plans. We process your information. If we need more information from you, we will contact you directly at that point. And then you do still have, during open enrollment, opportunity to change plans at that point. Even in retirement, that open enrollment option does not go away, as well as any qualifying events. So if you are moving and you're moving out of your health plan, you can take that opportunity to find a plan that's available where you're moving. So this is just showing you the plans that are available in 2022. There were some plan changes for 2022. They actually added more options for you for Medicare. Now, Theresa talked about Medicare Advantage plans or Part C plans, and then she also talked about Medigap or Medicare Supplemental plans. So CalPERS offers both Medicare Advantage plans and Medicare Supplemental plans. All of the plans cover everything that Part A and B covers, and all of them cover some additional benefits as well, depending on the plan. Some of them have a transportation benefit, a meal delivery benefit, over-the-counter benefit, acupuncture, chiropractic, etc. So you can go to the CalPERS website to look at all the specific plans and see what they cover. With your Medicare Advantage plans, It is a co-payment structure, so there's no deductible. And some of the plans actually have no co-payments for most of the benefits. So again, you'd want to look at the CalPERS website, which I'm going to show you in a couple slides, and you'll be able to compare the plans. The Medicare supplemental plans, also there's no deductible on those. And I believe for the most part, there are few, if any, co-payments for those benefits. So you are looking at which plan works best for you, which plan is available in which area. Maybe you're looking at the plan you're in now as a basic member, seeing if that's offered as a Medicare member. So I guess I'll read them through. The Anthem Blue Cross Medicare Preferred PPO. Then you have, which is new to 2022, Blue Shield Medicare PPO, which is nationwide. The Kaiser Permanente Senior Advantage Plan, which is in parts of some states. Then you have the Sharp Direct Advantage HMO plan, which is available in San Diego. There are 2 United Healthcare plans, United Healthcare Group PPO, which is nationwide, and then the United Healthcare Edge PPO is new for 2022, and that one offers a plan with no co-payments, except for, I believe, acupuncture and chiropractic and probably pharmacy. That's available nationwide. And then Western Health Advantage is another new plan for 2022. And then for the Medicare supplemental plans, you may be aware that it used to be the PERS Care, PERS Select, PERS Choice. Those have now changed in 2022 to PERS Platinum Medicare Supplemental and PERS Gold Medicare Supplemental. Platinum is available nationwide and Gold is available within California. This is the certification of Medicare status form, and LACCD, the staff is very familiar with all of these forms and can help walk you through anything that you need to a certain extent. So if you are retiring before or at 65 and you meet that eligibility for Medicare, you have a 2-step process. First, you contact Social Security about 3 months prior to that event, either your 65th birthday or your retirement date. You enroll in Medicare Parts A and B. Then when you get your Medicare card in the mail, you can complete the certification of Medicare status form. And then you also, if you want to change plans, you can change plans on this form in the kind of the middle thin box, name of health plan you would like to enroll in. And you can send this back to CalPERS. In some situations, they don't send you this form. They're actually getting a feed of Part A and B effective dates, and they will move you into the plan that is either associated with your basic plan or is sort of their default plan. This is the HBD 30. I'm just showing this so you can see the form. If you're going to make any type of changes in retirement, you're going to add a dependent, remove a dependent, etc. And these can all be found on the CalPERS website. And then this one is for people who are going to continue to work beyond 65. You would contact Social Security and you could enroll in Part A, especially if you are actually with all of the CalPERS plans, you can enroll in Part A while you're still working. You're just going to defer that Part B. Then you can complete this ineligibility of Medicare certification form. And this lets CalPERS know you're not retiring, you're going to continue to work, you're going to continue to maintain health benefits through your employer. So this is the CalPERS website. You want to make sure you become familiar with this website, especially the retiree section. So it does have everything you could possibly need or want to learn about. I spend most of my time in the retirees and then the health and Medicare section because my work involves our Kaiser Medicare plan for CalPERS. You can search for plans by zip code, and that is at that first arrow that says health plan search by zip code. You can look at rates and employer contributions, both for the current year and the upcoming year. So you've got 2022 there, which is coming up, and then 2021. You can view all of the plans information, so all of the summary of benefits, the evidence of coverage, etc., by clicking on this bottom line at the bottom, view all health plan summary of coverage and evidence of coverage documents. You can also find all of the contact information for all of the plans. They do have dedicated phone numbers and dedicated websites. And then over here on the side at the bottom in the gray, now it does say 2022 Health Benefits Summary PDF. This is a good place for you to go during each open enrollment, and then definitely when you are retiring, because it will show you all of the plans side by side. So you can get a high level comparison to see what are the main benefits offered in each plan. What is the payment structure? Is it a co-payment? Is it co-insurance? Where are these plans offered? So it's nice when you do need to pick a new plan. It's also nice during open enrollment. If you just want to do a little gut check, there'll be information on what's changing with the plans, etc., all in that PDF. And I think that is all I have. I just do have some phone numbers here. And then again, on that CalPERS website, you can find all of the phone numbers for all the health plans and their dedicated websites as well.
Thank you for that information. That is very helpful. Mm-hmm. We're going to have next Anthem Medicare plans. So we have with us today both Wendy and Tammy from Anthem, and they are going to give us.
My name is Tammy Rowe, and I'm a sales account representative with Anthem, and we'll be discussing the 2022 Medicare plan options. So today's presentation, we're going to be highlighting the PERS Supplement to Medicare PPO plans, as well as the Medicare Advantage plans that are available to you. And then the resources and tools that come with our Medicare plan offerings, including the Medicare Wellness programs, our Sydney Health mobile app, and telehealth services. So we've simplified the PPO offerings this year. So you may have been familiar with the PERS Care Supplement to Medicare. The new name for 2022 is called PERS Platinum. So this is going to be the same nationwide provider access and plan design as the original PERS Care Supplement to Medicare. And then we're offering a PERS Gold, and that was formerly known as the PERS Select Supplement to Medicare. And once again, the same nationwide provider access, and then the plan benefits were similar to the original PERS Select and PERS Choice Supplement to Medicare. So instead of having 3 offerings, we're actually making it a lot easier for you and offering 2. So the PERS Choice Supplement to Medicare will be discontinued effective January 1st. So anybody who was enrolled in that and they do not make an election will be automatically rolled into PERS Platinum. So the 2 supplement to Medicare options. So the PERS Platinum, there's for the PERS Gold and PERS Platinum, the acupuncture and chiropractic is a $15 copay with 20 visits combined. You have the silver sneakers. There are Christian Science nurse practitioner or nurse and practitioners. We offer hearing aids. So the difference between the 2 plans, the copays are $0. I'll go into that in a minute, but the hearing aids is one of the main differences. So under PERS Platinum, Anthem will cover 80% up to $2,000 every 24 months. And PERS Gold is $1,000 every 36 months. Both plans offer smoking cessation, vision exam that includes 1 exam and 2 lenses each calendar years, and then 1 set of frames every 24 months. Skilled nursing facility, this is the other difference. So the only 2 differences are hearing aids and skilled nursing facility. So with PERS Platinum, it's going to cover days 101 to 365, where with your Medicare Advantage and your Medicare Supplement PERS Gold plan, it covers days 1 through 100. So basically the Platinum will pay through the rest of the remainder of the year. And then your inpatient and outpatient coverage is covered at 100%. Physical, occupational therapy, speech therapy, and blood replacement. So the PERS Supplement to Medicare gives you full access to care no matter where you go in the country. So Anthem's going to pay 100% of the Medicare deductible and the Medicare coinsurance for approved services. It offers nationwide coverage with no deductible or copay. So the PERS supplement to Medicare offers $0 copays for doctor visits, out-of-pocket costs for Medicare participating providers nationwide, and as well as it offers coverage for urgent and emergency care services anywhere outside of the United States. There's ambulances services, and your prescription drug benefits will continue to be administered through Optum Rx. So that way you don't want to enroll into any other Part D plan. If you elect to enroll in a PERS supplement plan, then you will automatically be enrolled into that Optum Rx prescription drug plan. Then we offer health and wellness programs. And then there's streamlined claims because Anthem handles everything for you, so you don't have to fill anything out. And then we have extra benefits beyond Medicare that include that silver sneakers, the vision, hearing aids, acupuncture, skilled nursing, the condition care to help you better understand if you have a chronic disease or a special illness that needs managing. We have that. Pre-diabetic program. And then we have more Medicare wellness programs that I'll run through quickly later. So in addition to the PERS supplement, Anthem also offers a Medicare Preferred Ppo plan. This one will be paired. This is the Medicare Advantage plan. So Anthem is the primary payer, and this will pair with if you have a dependent that is not Medicare eligible, this pairs with the HMO. And so, this plan, it's national access throughout the United States. There's a $10 copay for physician visits. And then the remainder visits are $0. So your annual wellness, inpatient care, outpatient surgery, routine hearing, vision, and foot care. This also offers emergency and urgently needed services outside of the United States. And then as you can see here, we have many more supplemental plans: healthy pantry, healthy meals, silver sneakers, the telehealth video, 24-hour nurse line, house call, and Medicare community resource support. So both plans, this kind of does a side-by-side comparison of the PERS Platinum and PERS Gold supplement to Medicare PPO plans, and then the Anthem Medicare Preferred Ppo Medicare Advantage plan. Both offer the 24-hour nurse line. So if you have any questions about a current treatment that you are enrolled in, or if it's midnight and you don't know if you should call the telehealth or if you should wait for an urgent care, you can call. The Diabetes Prevention Program helps members who have prediabetes from developing diabetes. We offer a health assessment to help you better understand your overall health. And then that Live Health Online allows you to connect with a board-certified doctor 24 hours a day, 7 days a week. And it also offers psychologists and licensed therapists. They can send prescriptions to your local pharmacy, and this is for such things as common colds, pink eye, or once again, if you would like to see somebody I know in certain areas, psychologists might be booked up for months or not accepting new patients. So this is a good alternative if you are seeking somebody to talk to. And Anthem also offers a My Health Advantage. So we're going to send you regular reminders about needed care or tests. Hey, you forgot your preventative health visit. This is just a gentle reminder. And then we'll send you some health savings tips as well. So both of them offer a Sydney Health mobile app and a secure member portal. So if you're not comfortable using your smartphone, we do offer Anthem.com. You can register on this site to find doctors. You can access your medical card. You can look at your explanation of benefits. And then we also offer Sydney Health mobile app for your smartphone or tablet. You can just download this. And it's your plan at the convenience of your fingertips. So you can take it on the go. It'll use your GPS to find doctors. Once again, Your ID card is there, and it has this special feature called My Family Health Record, so that, especially with these PPO plans, your primary care physician may not know what doctor you're seeing because there's no referrals needed. So it's all located in one easy, convenient place that you can share with your doctor. We have special offers that offers discounts for certain services such as LASIK or vitamins. Silver sneakers, I'm sure you all are aware of that one. This is a feature that you can go to any gym that participates in the program, but you don't have to become a member and you don't get pressure to become a member. So if you wanted to see a class at one gym and use the weights at another, that's available to you through Silver Sneakers. And then they have on-demand classes and Facebook Live events. And then Condition Care and Wellbe are programs offered to PERS Platinum and PERS Gold. So Condition Care offers disease management for asthma, diabetes, COPD, and heart failure. And then Wellbe uses an online program to help you decide for a surgery. It just basically reviews the surgery criteria and the facilities. So now what the Medicare Advantage plan offers is community care coordination, where if there's a high utilizer, we'll help you with your health benefits by identifying gaps in care. And we'll basically pair you up with a community health worker. The House Call program, this offers a personalized visit in your home. Some people are not too happy about going to the doctor right now, with the COVID pandemic. You can actually have a doctor come visit you in your home, and there's a $50 incentive for that as well. And then it'll just be a quick assessment, and they'll send that to your doctor and give you a copy as well. Healthy meals. So if you're discharged from the hospital, or if you're eligible by being diabetic, there's certain criteria for underweight or overweight, you may qualify to receive nutritionally balanced meals delivered to your house. And then Healthy Pantry is kind of on that same line. You'll receive monthly nutritional counseling sessions via phone, but you'll also get a monthly delivery of non-perishable healthy pantry items. And then that counseling will work with you to come up with some nutritious alternatives and meal planning. One of my favorites is Medicare Community Resource Support. So this one offers such things as, do I qualify for assistance with my utilities, or, I need a ride to the grocery store or a friend's house. We can work with your community to see what programs are out there for you. There may be a special service for transportation that is non-emergency, that is not qualified under the plan. And so you can just call the number on the back of your card. And they also offer you, if you wanted to see if there's any social events or country line dancing, you can call that number as well. And then we do offer non-emergency transportation. So this covers one-way trips to and from your doctor, a pharmacy, or one of the gyms through the Silver Sneakers locations. We just ask that you give us 48 hours in advance to make sure that we can accommodate your schedule. So I know this is a lot of information. So if you have any questions, we are here to help you. And of course, we have the breakout room after. So we have the PERS Supplement to Medicare PPO customer service line at 877-737-7776. And then we have the Anthem Medicare Preferred Ppo plan. It's called the First Impressions Welcome Team. And that phone number is 855-251-8825. Thank you so much for allowing me the opportunity. Oh, sorry, I forgot about this one. This is the premiums. Now, this doesn't necessarily mean that it's what you're going to pay, because we don't know what you pay or what your supplement is. So PERS Platinum, these are just the rates for the single party and two party for PERS Platinum, PERS Gold, and the Anthem Medicare Preferred PPO. And then the Anthem Medicare Preferred PPO is offered in every county this year in California. So as long as you live in California, you're set to go with the PERS, the Anthem Medicare Preferred PPO. So thank you so much for allowing me that time, and I look forward to seeing you in the breakout room for any questions.
Thank you so much, Tammy. Okay, with that, we're going to now turn the mic over to Sunny Smith. She's the Territory Manager for Kaiser Permanente, and she's going to review the plan for Medicare Advantage program that is well known for Kaiser's HMO product.
Good afternoon, everyone. I am Sunny Smith. I am the Territory Manager for Kaiser Permanente, and I am delighted to be here with everyone this afternoon to discuss the highlights of Kaiser Permanente's plan. So I will start with our proud accomplishment. We are a 5-star rated plan in in California for Kaiser Permanente for 2021. We have held that status for several years consecutively, so we are quite proud of that accomplishment. The Centers for Medicare and Medicaid Services, CMS, they rate all of the Medicare Advantage plans annually based on 5 major categories, including preventive care, chronic care, prescription drug services, customer service, and member satisfaction. You can see the star ratings for our other regions. CalPERS members who live within the service area in any of our regions can enroll in our Kaiser Permanente Medicare Advantage plans. If you want to learn more, you can look at our the Medicare website at kp.org/Medicare stars, one word. Okay, so I am going to move on to the highlights of our Senior Advantage plan. So we do have a no deductible on the plan, and there's no lifetime maximum. The maximum amount that you will pay in medical co-payments is $1,500. So that is your out-of-pocket maximum that is there for your protection. For an individual, and for a family, that is $3,000. Our office visits have a $10 copayment associated with them and a $50 for any emergency room care. There's no cost for hospitalization, lab, radiology, and durable medical equipment. There's also an optical eyewear allowance, which gives you a $175 benefit every 24 months, as well as a hearing aid allowance for $1,000 for every 3 years, which is every 36 months. And then we also have vision benefits on the plan. So it is very important that you have your eyes checked regularly to spot minor as well as any severe eye problems. When you can see clearly, daily activities such as driving and reading become much easier. Your United Healthcare Kaiser Permanente Senior Advantage plan includes that vision benefit that we discussed for $175 every 24 months for eyeglasses and contact lenses at any Kaiser Permanente Vision Essentials location. And also there's hearing benefits on the plan as we discussed. So we encourage you to take advantage of your hearing aid benefit, which gives you a $2,500 per ear every 36 months. So that's equivalent to 3 years. You can contact your Kaiser Permanente doctor or audiologist for more details. And also our Silver and Fit program is our exercise and healthy aging program. You can choose the exercise plan that best suits your lifestyle. You can opt for a gym membership with participating fitness facilities, and you can also receive a home fitness kit each year that will focus on Pilates, stress management, or chair dancing, to name a few. You can also participate in live classes and access videos at silverandfit.com. And our meal delivery plan gives our members post-discharge meals. You can get up to 3 meals a day for up to 4 weeks post-discharge from the hospital or any skilled nursing facility. The meal benefits can be used only once per calendar year. The meals are refrigerated and can be reheated in an oven or microwave. In addition to general health, a variety of condition-specific menus are available, including for any member that may have diabetes, any renal concerns. If you prefer a low sodium diet, that type of meal is also available. We also have gluten-free and pureed options as well. And finally, our transportation benefit. You can get a ride to and from any of your appointments at no cost. Your plan covers up to 24 one-way trips, up to 50 miles per trip per calendar year. Get rides to doctor's appointment, medical services such as lab or x-ray, picking up any of your prescriptions or medical equipment. We utilize rideshare, taxi, or private transportation. All of those services are available as a Medicare Advantage member. We also have wheelchair van and gurney van services for anyone who may be needing those accommodations. So thank you so much for listening, and we invite you to join us at the Kaiser Permanente breakout session where we can get into more specifics on any of the Medicare Advantage programs, as well as other perks that we have associated with our plan. I'll turn it back over to Katria.
Thank you. That was awesome. You know, becoming senior is not as bad as I thought. A lot of perks here.
Again, this is Alex. I am the account representative at Blue Shield of California, and I'm going to talk about the brand new Blue Shield Medicare PPO plan that will become available on January 1st of 2022. Really excited to bring this to all of you because this will give you an extra option for you to look at and consider for enrollment. Now, for those of you that are familiar with Blue Shield, you may be familiar with our mission, and we plan to strive to create a healthcare system that's worthy of our friends and family. So we've been a part of the CalPERS program for over 18 years and really looking forward to many more years of service to you. So with regards to the Blue Shield Medicare PPO program, so I'm going to go over what it is and how it works. If you're familiar with the PPO, you'll know that with the PPO, you are allowed to have coverage in both contracted network providers as well as out-of-network providers. So this gives you the option of being able to access care from a Blue Shield of California provider or a non-Blue Shield provider. So you are able to go to doctors and access care anywhere in the US. So this gives you the opportunity for you to be able to move to another state and access care. So it gives you really the freedom for you to get the services that you need at any place that you might be, you might find yourself. Now, the unique feature of the Blue Shield Medicare PPO plan for CalPERS retirees is that the member cost sharing is the same whether you're going to access care in-network or out-of-network. And we'll go over what that means in terms of coverage. So just real quick, I'm going to jump to this section. So you'll see there are, I'm going to start by saying that there are no deductibles on your PPO plan provider. You'll experience a zero copay, so no copayments to access your laboratory services, hospital services, x-rays, physician visits or urgent care, and you have additional benefits with regards to acupuncture and chiropractic services, as well as podiatry and routine vision exams. Emergency services will be covered worldwide. So no matter where you find yourself, you're going to be covered for the emergency service that you find yourself in. Your copay, as you'll see there on the screen, it's $50. You do have a pharmacy benefit. I'm just going to switch over screens real quick so you can have a quick look of what the copay structure is. So you'll see that if you're looking for generic medication, your copay for a 30-day supply is $5, $20 for preferred brand. Non-preferred brand drugs is $50, and specialty tiered brand drugs is $20, as you can see. And you'll see the other services, other expanded retail or mail order cost right there on your screen. And really looking forward to talking to you individually if you have any further questions on these services. In addition to the services that we talked about, you also have Teledoc. This allows you to speak to a live physician over the phone. So this is a real doctor that will provide consultations and be able to provide a prescription should you need one. They are available 24 hours a day, 7 days a week, and you can access care whether you're on the phone or would prefer to do a video chat. As you'll see, your consultation is a zero copay. In addition to that, in terms of virtual care, you have another service there. It's a nurse helpline, again, 24/7. And so if you're looking to get medical advice and you'd like to speak to a registered nurse, you can do so as well. Both options are available, whether you prefer to speak to a doctor or a nurse. They're both available to you at a zero copay. And you do have additional resources available if you'd like to find a doctor or get information about your plan design as you consider many options that are available to you. We do have a website. It's blueshieldsca.com/CalPERS, and you'll be able to download a lot of material that's available, including the plan design that I shared earlier right here on your screen. You can download that directly from the website. So you have a detail of what is included in your Blue Shield of California Medicare PPO plan. So I always try to be brief because I'm sure there's probably more to cover, but if you have any questions, please join my breakout room. I'm really happy to be able to talk with all of you. Thank you.
Well, greetings, everyone. My name is Aaron Love, and I'm Senior Client Service Manager with United Healthcare. And thank you for the opportunity to speak with you today about the benefits and programs available to you through CalPERS Medicare Advantage plans. We're excited to have an opportunity to share with you information about your new plan, about your plan and your new plan, so you can make an informed decision on which plan to choose for in 2022. So there are two plans that will be offered by United Healthcare effective January 1st. The first plan is actually the current plan that is offered CalPERS Medicare retirees through United Healthcare, and it will continue to be offered in 2022. It is called the United Healthcare Group Medicare Advantage Prescription Drug Plan. I will be referring to it throughout the presentation to make it shorter, calling it the Group MAPD PPO plan. And so, again, if you're currently enrolled in this plan and satisfied with it, you can stay with it since it will continue to be offered. And then there's going to be a second plan a new plan that's going to be offered effective January 1st. And so it's called the Medicare Advantage Edge PPO plan. And so the purpose of offering this plan is to offer prospective retirees another option to choose from with $0 co-payments and cost share for most benefits. So I'll be talking about the benefits of both plans in comparison to one another. And so again, the purpose is so that you'll have the information to make a more informed decision on what plan to choose for in 2022. At United Healthcare, we want you to know we are here for you. We are here to help you make the most of your plan by connecting you to the care you need, when and where you need it, and offering one-on-one support to get you what you need. We are able to provide programs like Renew that offer a variety of useful resources, activities, rewards in some cases, and learning courses at no additional cost. We also have Medicare's largest provider network and one of the most comprehensive drug coverage programs available. I'll be talking about the differences between the current MAPD PPO plan and that for the new Medicare Advantage EDS plan in future slides. With your choice to pick up prescriptions at a local pharmacy or utilize the Optum Rx mail order pharmacy, it's like having a drugstore at your fingertips. United Healthcare is proud of having served the healthcare needs of people just like you for more than 40 years, and you can count on us to be here when you need us. So let's review the plan benefits, programs, and features that are a part of the Group MAPD plan. Again, that's the current plan that is offered and will continue to be offered in 2022, and the new MA Edge plan that will be offered for CalPERS retirees. So both of the Medicare Advantage plans, the Group MAPD PPO plan and the MA Edge PPO plan, are national PPO plans. What that means to you is that you will be able to utilize doctors, clinics, and hospitals all across the United States and U.S. territories for the same cost share. And whether the provider is an in-network provider or an out-of-network provider, as long as the provider participates in Medicare and is willing to bill United Healthcare, you'll have coverage and your cost share will be the same. So under the plan, there will be coverage for hearing, chiropractic care, and there is no referral needed to see a specialist with this plan. So you have the ability to self-refer, and you're not necessarily tied to seeing providers, physicians, medical groups who are only in network. So again, to reiterate, both the Group MAPD PPO plan that's currently offered, as well as the new MA Edge PPO plan that will be offered, both plans allow you to visit doctors and providers who are in and out of United Healthcare's network for the same cost share to you, as long as the out-of-network provider participates in Medicare and is willing to bill United Healthcare. And so here in California, there are approximately 37,000 providers here who do accept Medicare. If you need help searching for a particular provider or to find out if your provider is currently utilizing United Healthcare's network on your plan, you can confirm that by searching online at www.uhcretiree.com/CalPERS, or you can always call our United Healthcare customer service dedicated line to CalPERS Medicare retirees at 1-888-867-5581. And even if your physician is out of network, they will be able to help you identify which one of those who are accepting Medicare. Now, as far as how much the plans cost from a monthly premium standpoint, here are the published rates, monthly rates for both plans, both the United Healthcare Group MAPD PPO plan and for the new United Healthcare MA Edge PPO plan. What your contribution would be, what you actually pay, is going to depend if you're a state retiree or if you're a retiree with one of the public agencies, and will also depend on your vesting as far as how much of this premium you would pay. But these are the published rates for each of the plan if you do want to do a comparison. So now I'm going to talk about the benefits and co-payments under both the Group MAPD PPO plan and the new MA Edge PPO plan. And so on either plan, there are no deductibles. And then the annual out-of-pocket maximum for the Group MAPD PPO plan is $1,500. So this is the most that you would pay for your medical benefits in terms of co-payments. And then for the new MA Edge PPO plan, there is no out-of-pocket maximum for this, because the covered medical services under this plan is actually a $0 copay. So under the Group MAPD PPO plan, there are co-payments, and then under the MA Edge PPO plan, there are largely no co-payments. So, for example, for the primary care office visits and specialist office visits under the Group MAPD PPO plan, you will pay a $10 copay, whereas on the new MA Edge PPO plan, if you choose to enroll in that plan, it's a $0 copayment. And again, all of these benefits are the same whether you go in-network or out-of-network. And preventative services such as annual physicals, immunizations, breast cancer screenings, and colon cancer screenings are covered in full at a $0 copayment under both the Group MAPD PPO plan and the new MA Edge PPO plan. For the new MA Edge PPO plan, the copay, your cost share is different, the allowance is different, and that for this plan, it pays up to a $2,000 allowance for hearing aids every 2 years. So let's talk about routine vision services and eyewear. So both the Group MAPD PPO and the new MA Edge PPO plans offer eye exams every 12 months at a $10 copayment for the Group MAPD PPO plan and at a $0 copayment for the MA Edge PPO plan. Now let's talk about prescription drug coverage. The current Group MAPD plan has the prescription drug benefit built into it. And so when you get your ID card, you'll have Optum Rx's information on that ID card, and you'll be able to access pharmacies and prescription information and prescription coverage. And so, but for the new Medicare Advantage Edge PPO plan, prescription benefits are going to be provided directly by Optum Rx. And so you'll get a separate ID card from them to access those benefits. Now let's talk about additional benefits that are offered both through the Group MAPD PPO plan and the new MA Edge PPO plan. So United Healthcare House Calls is a program that allows you to have a yearly in-home checkup to help you stay on top of your health. Again, this benefit is free, so there's no charge for you, the member, to access this benefit. And there's actually a $15 gift card for you if you do choose to do our House Calls program. So it's a great benefit. Silver Sneakers is always a favorite added benefit in our plans. It's currently included in our plans and will continue in 2022. Another great benefit of both plans is the Real Appeal program. And so the purpose of this program is to reduce the risk of developing serious health conditions, gain energy, and achieve your long-term health goals, whether it's maintaining or losing weight, improving nutrition. And so it's a step-by-step online program that helps try to make it fun. And with it, you get a transformation coach who leads weekly online group sessions. You get online tools to help you track your food, activity, and weight loss progress. And you also get a success kit with food and weight scales so you can measure portions, recipes, workout videos via DVD, and so much more. And this is provided at no additional cost to you. And formerly called NurseLine, telephonic nurse support was designed specifically to help make your health decisions simple and convenient by providing immediate answers to your health questions at any time, anywhere, 24 hours a day, 7 days a week, at no additional cost. So hearing aid benefits are provided both under the Group MAPD PPO plan and the new MA Edge PPO plan. For the Group MAPD PPO plan, the allowance is $1,000 for every 3 years, and the allowance for the MA Edge PPO plan would be $2,000 every 2 years. Also included in both plans is a post-discharge meal delivery benefit, which is a program that helps you focus on your recovery without worrying about having a healthy meal after an inpatient hospital or skilled nursing facility stay. Similarly, there's a routine transportation program that will also help you get to health-related appointments easier and at no cost to you. The program offers rides to medical appointments and to the pharmacy for prescriptions. And so this is post-discharge. So if you're hospitalized, you can receive unlimited rides once you have been discharged for up to 30 days when you're referred by your United Healthcare clinical advocate. So thank you for listening to our presentation and walking through the Group MAPD PPO and the new MA Edge PPO plans that United Healthcare is offering CalPERS Medicare retirees for 2022. And so we want to thank you, and we look forward to welcoming you to our Medicare family.
Hi to everyone. I'm Karita Hughes. I am with the Health Benefits Unit, and this will be a short presentation on making sure that your employer does his or her part, in this case, her part, in helping you to sign up for Medicare. With that said, let's move to the next level. First, they've already said throughout the process to create your Social Security account. So I do recall that Katrelia did drop some things into the chat, the link for the Social Security account and starting the Medicare process. She's going to drop the one that I provided for her into the chat now. Those of you who need to sign up for Medicare are going to click on that link that she just dropped into the chat that I sent to her earlier. And you're going to keep that link open in the background so that when we log out and everyone goes on his or her way, you'll have that link open in the background of this presentation, and you will start the process of signing up for Medicare. With regard to LACCD's requirements, first and foremost, two things. If you're employed with LACCD and you have no intention of retiring or resigning or moving on anytime soon, then you do not need Medicare. So if you're here just because Katrelia sends out those awesome emails and you felt a need to be within her presence because of those emails, it's fine to be here. If you're not planning on retiring, resigning, or anything, you're just information gathering, please do not sign up for Medicare. Just use this as an information opportunity. With regard to those of you who are already retired or who plan to resign and retire, the first thing to do is to resign. If you took part in the supplemental retirement, and hopefully you've attended the previous presentations that we've given on the retirement process, then you've already done the resignation part. In order to resign from the district, you need to submit the HRP 310, as well as we learned recently something known as an HRP 311. The 311 is the I do not have any of your equipment form, and you give it to your HR personnel. Again, those of you who have attended the previous workshops, we have dropped those into the links. For those of you who are just doing research, just know that these are the two forms that you'll be looking at in the future. If you're doing research again with the resignation, you will start with your campus you will start with your location to get those forms. With regard to the forms that you will submit to me, again, SRP, I already know that the SRP people are retiring. For those of you who are not part of SRP, this is the application for retiree health benefits. We have dropped it into the chat for previous chats. We'll drop it this time if we feel that you need it or if you indicate that you need it. It's already dropped into the chat. With this form, you will submit it 30 days prior to your retirement. Most people are retiring that I know of on December 30th or 31st. Consequently, you will drop this into the chat. You will submit this to the health benefits unit on December 1st. This triggers me to start looking for you to commit your name to memory, things like that I will need to do. The email address is on the second page of the form, which will be a scroll down since it's a PDF format. Scrolling down to the second page, that is the email address where you will submit the form on December 1st. If you're many of our STRS participants may choose to retire on December 15th or 17th in coordination with the last days of their classes. I understand that there are a couple of rules around that, basically that you must have completed your finals. So if you're retiring on December 17th, which some of our STRS members are doing, then today you can go ahead and submit it, and I'll start to commit you to memory, and I will also start looking at your age and getting ready to send out the Medicare form. That's for the STRS people who have already indicated they're retiring on the 15th of December. Now, the thing that you really are interested in here is if you're Medicare eligible, what do you do? First and foremost, for those of you who are 65 or older or who have a spouse, domestic partner who is 65 or older, When I receive this form, I start to look at everyone's age and I start to determine whether you need Medicare or not. In addition to me utilizing this form, again, I know that many people are with the SRP. I use the paperwork that that Human Resources sends to me to determine the ages of you and your spouse and or domestic partner to determine if you need the Medicare application, 65 or older. You will receive the Medicare application from me. And what will happen is you'll take it you'll log online, you'll start the Medicare process. LACCD requires that you have Medicare A and B if you're retiring. At the time of retirement, Medicare A and B. For those of you who are retiring anywhere within the month of December, from December 1st to December 31st, if you're retiring within those months, or if you're resigning, I'm sorry, from December 1st to December 31st, then your Medicare A and B should be in effect on February 1st. That's why I'm not rushing that much, because I know that you have an extra month. What will happen is you will stay on the basic benefits for the month of January. You stay on the basic benefits, the benefits that you have today. You will keep the benefits that you have today for the month of January. Within the Medicare process, you will be given the opportunity, not only A and B, you will be given the opportunity for Medicare C. Medicare C is the LACCD plan. So you don't have to get, they may call it any number of things, Medigap, Meta, in between, Meta, whatever. You do not have to get that. We cover your Medicare C. You will be given an opportunity for Medicare D. Oh my goodness, do not sign up for Medicare D as in dog. That is something that CalPERS health insurance plans will sign you up for. They sign you up for Medicare D. You do not do it as an individual. The health plan will sign you up for D, and they will send you the bill. So do not sign up for D. If you sign up for D as an individual, you will lose your CalPERS plan. So I only want you to take an interest in A and B. Know that the district covers C, GAP, and all the other alphabets. Avoid D as if your life depended on it, because your medical does. As I'm sending the Medicare form to our pending retirees, I will send it through the district's network of KiteWorks. And the reason I use KiteWorks is, number one, it's a secure network. But number two, it gives me the opportunity to track who's downloading and who's not downloading. And that's the most important thing, because I've always had this fantasy to be a spy or something. So I'll know who I need to follow up on if I don't see that you've downloaded it, or who I need to just go ahead and put it into US mail because you didn't download it. In addition, some of you tend to reach out to me using Gmail and all of these other things. I am not comfortable sending your Social Security information through Gmail unless I use the secure network, because it scrambles the data. So if you see something from KiteWorks, from Hughes CL, then just know that that's me. I usually put that it's Medicare application for either you, your spouse, or domestic partner. It is me. So you can open it from Hughes CL as long as I gave you the title, Medicare application. You can also send an email to Hughes CL that you send this to me. This is the HBD 30. The HBD 30 is not needed unless you're planning on actively changing plans. And what I mean by that is, if, say, you're in Kaiser and you want to move to PERS Choice. What I do not mean by that is if you're in Kaiser and you want to go to Kaiser Medicare or Kaiser Senior Advantage. That's not changing plans. You're changing plans. You're going from one plan to another. So the times that you will submit the HBD 30 is at the time of retirement. And again, I went into detail at some of our retirement workshops that we've had earlier. At the time of retirement, if you're adding or deleting dependents, if you're moving, particularly if you're moving out of state, if you're changing health plans, and again, that's from one health plan to another health plan, not from basic to Medicare status within the same plan. If you're changing health plans, and like I said, it's not needed for Medicare, or if you're terminating coverage, the people who might want to terminate coverage are individuals who may partake of a retirement incentive, or who may be retiring and they are not vested for district health benefits. If you're retiring and you're not vested, the good news is you can buy into LACCD's PERS sponsored health benefits. The bad news is they automatically assume that you're going to buy into it and will start to take the deduction from your retirement check unless you notify them that you want to terminate. So if you're not vested, or some people, if they're only partially vested and want to go on to their spouse's health plan, then they will submit this to me so that I can take them out so that they're not deducted. To start the process, and again, I know that many of you are either already retired or just trying to consider what to do. You will start with your contacts at the campus. For those of you who are researching, you'll go to the HR payroll at your campus or the district's general HR services email address to get the forms that you need. And just to be clear, Katrelia has already dropped this presentation into the chat. So you're going to click on the presentation, as well as I've seen her dropping a lot of things into the chat. You're clicking on those things. They will give you the opportunity to download onto your computer so that you can have this information once we close out. Finally, with regard to the retirement process, if there are any forms that you need, or if you need to reach out to HBU to get the forms or to submit your Medicare information or whatever, then you will use the HBU Health email address here. For those of you who are retiring or who are leaving, this does not relate to Medicare, but people often are interested. Your unused balance will be handled by the retirement unit, and you're submitting your express benefits report to the retirement unit. For PERS people, you're doing nothing. We already know to report your unused illness. With that, I am done, and I will see you in the breakout room for additional questions.
Okay, the breakout rooms are closed now. There may be some additional questions. I saw we had quite a few still left over in the Social Security room and the health benefits room, or the Social Security and Medicare room. What question did you have, and for whom?
Yes, again, just that clarification here regarding the HBD 30 form. It was mentioned that we don't have to submit this if we are not changing anything.
Karita, are you here?
That's correct, Anna. If you're not making any changes, you do not need to submit HBD.
Okay, so if I'm keeping my dependents and I keep in my same type of health benefits, my Anthem plan, I don't have to do anything.
That is correct.
Thank you.
Thank you, Anna. David?
Yes, hi. I'm an adjunct at Pierce College. I'm 65, so I just filed for Social Security and I got my Medicare. I'm still holding my insurance through the LACCD. My question is, but I'm confused. Should I hold on to that, or should I just get the Medicare and get a Part B, or what should I do? What's the best way to do?
Number one, we never advise on what people, quote, should do.
Right.
And number two, I would advise you to go to your union. They've negotiated a arrangement for those individuals who are retired for adjunct faculty. Your union has negotiated something recently that it will give you the opportunity to move into the district Medicare plan much cheaper. So you'll need to go to them just to get understandings on the instructions of the things that you have to do. If you still have your plan, your medical through LACCD, then we will move you to whatever the union has negotiated, but go to them to get a better understanding and to get those forms.
By the way, my Social Security retirement was not through LACCD. It was through my outside private professional career. Does it make any difference?
No, what would negotiate, what was negotiated with your union is based on you being an adjunct faculty member. So definitely go to them.
Okay, I thank you very much. Appreciate it. Sure.
Okay, David Falk.
Thank you.
Thank you, Catrella. This question is for Carita. Carita, a follow-up to an earlier question I gave you. Once I submit the application for retirement benefits, you mentioned that your office doesn't give an acknowledgement. So how would I know that the insurance process has been completed?
Medicare becomes your insurance and we become a supplement. So you'll receive a new card acknowledging that Medicare is your insurance and that we are a supplement.
Will it say on the Medicare card that LACCD is the secondary? Will it actually state that on the card? Because I have a card already for
cards. I don't know how they look. I just know that they come from whichever insurance you're enrolled in, and they will indicate that you're now Medicare primary or Medicare, and that LACCD's insurance is a supplement.
Theresa, could you chime in for us here?
Yes, well, so once you're retired and no longer have insurance based on your active employment, Medicare is your primary, but it doesn't state that on your Medicare card. But your other card is going to say Medicare Advantage, so they're going to know that this is linked up, or might say Part C, but it will probably say something about Advantage. The word Advantage will be on there, so the provider will know that you also have Medicare. So when you go to the doctor or the hospital, present both cards, and the billing will know to bill Medicare first and the other insurance for the remainder.
All right. So if I sign up for Anthem Blue Cross for the CalPERS Platinum Plan, the card you guys are talking about is going to be a card sent to me from Anthem. Is that correct?
Yes, from Blue Cross.
Yeah, yes, Tammy, could you chime in on that one?
Yep. So you're going to keep that Medicare red, white, and blue card, and then Anthem will send you your PERS supplement card, and then you'll receive your Optum RX card from Optum. So you'll have 3 cards.
Okay. All right. So that's what I guess that answers my question. That's what I'm going to look for is an Anthem card and a Optum card.
Correct.
Okay. Nothing from CalPERS then at that point.
Not for like anything for medical that you would need to bring for the doctors. You'll receive a confirmation of enrollment from Anthem as well. So
that's what I was looking for. That answers the question. Great.
There you go.
All right. Thank you all very much. That answers my question. Thanks again.
Right. Okay. We're going to move on and take now Ruben.
Hi. Hello. A couple of questions for Theresa. Yeah. So in regards to Social Security payments, does everybody get the same amount regardless of income, however much they made a year?
Right. So no. So your Social Security payment is based on how many years you worked and how much you earned. And so the calculation is actually a little bit complicated, but your payment is based on your earnings. So so the more you made, and these are years where Social Security was withheld from your pay. So the more you made, the more your Social Security payment is going to be. When we calculate your payment, we go by your highest 35 years of work and how much you made, of course, and you get a percentage of that back in a Social Security payment. But we also want to control poverty because so many seniors live below the poverty level. So we pay, so even though I'm a high wage earner and the more years you work, the higher your payment, we pay a wage benefit. So a lower wage earner gets a smaller payment, but a higher percentage back. You only need 10 years of work to get a Social Security payment, but we use 35 years when we calculate the benefit. So the person who only had 10 years of work where they paid into Social Security, we're putting 25 0 years in the calculation, and it makes your average monthly earnings much lower than the other person who had 35 years of work where they were paying into Social Security. So, a multimillionaire will get a Social Security payment. And, just like a person who was a lower wage earner would get a Social Security payment. We call it being insured. So when you work and you pay Social Security tax, we say you were becoming insured for a Social Security payment.
Okay. And in regards to the number of credits, if a person has more, can a person earn more than 40 credits? And will that mean like a larger payment? Right.
So the minimum that you need is 40 credits, and you earn 4 credits a year. So this year, for example, if you had covered earnings of 5,600, you will have earned all 4 credits that you could possibly. 5,880. You've earned all 4 credits. So that's how you become insured. But then the higher your wages, the higher your payment is going to be.
You get more than if you.
Well, you'll get more, not because you can't be more insured than anybody else. So if I have 40 credits and you have, several hundred credits, we're both equally insured. However, your payment will be higher than mine because that indicates that you had more years of work where Social Security was withheld from your pay.
Is there a survivor benefit for, so if like a domestic partner or, a married couple, is there a spouse survival benefit? If one of them were to die, could the person's benefit pass over to the surviving spouse?
Yes, and so it's all of these things are very, very complicated. But the survivor benefit can be paid to the spouse who's age 60 or older, or who's 50 or older and disabled, or to a surviving child who's under 19 and still in high school or younger than 18, or an adult child who became disabled prior to age 22. So there are these survivor benefits. But if you're, so let's say my spouse passed away, and I could receive on his record at age 6 when I turn age 60, and then I might be able to switch over to my own when I become retirement age myself. Or I might want to keep receiving on his and let my retirement benefit continue to grow. So a retired person couldn't get both. You would need to choose, do I want the survivor benefit or do I want the retirement on my own? And you can actually strategize. And so you can decide, I'm going to receive, let's say my husband was the lower wage earner. I could say, I'm going to receive on his, and then I'm going to switch over to my own at age 70 and completely max out all these delayed retirement credits and get a very high payment. Or I could say, let's say my husband was a higher wage earner. I could receive my own retirement at 62, then switch over to his at my full retirement age and get 100% of his benefit amount. Okay. So if somebody's a survivor, we want to talk to them a couple months before they turn age 60 so that we can review the scenarios and they can decide which benefit to take first and which benefit to take later. It's usually better to take the small benefit first and the large benefit later.
Okay. Thank you.
Okay, thank you.
All right, John Milhon.
Thank you, Katrelia. The question that I have is, I'm retiring I'm already age 65. I'm retiring at the end of the year. I already have my Medicare Part A in. I need to put in Medicare Part B. I understand from what Theresa said earlier, I need to put in a CMS-40B form and a CMS-L564 form. And I guess my question is for Carita. I think the LMS 564 form, I send that to the health benefits unit and then you send it back to me, or can you give me a little more insight into how that might work?
Hi, you do not need to send the L564 to me. I already have copies of it. I send it to you. I will get a list of individuals who are retiring, and I will automatically look at their age and the age of their spouse or domestic partner. I will start sending that out to everyone December 1st at least, but I think I may have some free time to do it next week as well. So I am going to send that to you. Are you part of the SRP?
Yes, I am.
Then I already have your name on the list. The only thing that you need to fill out is the 40B.
Okay,
the
will do.
L564, it will come from me already filled in.
Thank you so much. The other question that I had was, if I'm going from a Medicare Advantage plan or a Medicare Advantage plan PPO in the district now, and I want to go to a Medigap Medicare plan after I retire, do I need to put in the HB 30 form to change my medical plan?
No, if you are already in, let's say, Kaiser Basic Plan, and now you're going to Kaiser Senior Advantage, which is like GAP, then you do not need to submit the HBD 30. They're automatically going to do it when you send in your Medicare card to CalPERS. You do not need to submit the HBD 30 to go to the Medicare portion of that plan.
Okay, because regardless of whether it's whatever it is, if you're not changing from one provider to another provider, you don't need the HBD 30
Correct.
form.
Correct.
Thank you so much. I apologize.
Anna.
I would like to ask a couple of questions to Theresa Campbell.
Okay, Theresa.
Okay, sorry, I had to unmute.
Okay, hi.
Hi.
Well, this is thing, I know now that I have to go into the Medicare website and sign up for Part B. Now, my husband has been retired for a few years and he receives Social Security benefits. I am not eligible for Social Security benefits. I have very few credits, but we are planning for him to stay as my dependent for the health benefits. Will his Social Security earnings be affected by this?
No, not at all, because he earned that. So Social Security is considered an earned benefit. You earn that because you worked and paid into it. So it's not the fact that he's receiving benefits, health benefits, or even if he were to receive a pension based on your earnings, it would not affect his Social Security because he earned that benefit.
Okay, but he has to go also and sign up for Part B.
Yes, when you retire, then he should sign up for Part B because he's no longer covered through your active current employment. He might be covered through your retirement.
Okay.
He's not covered through your active current employment. So he'll need Part B or else his other insurance can drop him.
Well, thank you. Thank you very much. Thank you.
Okay, thank you.
All right, Lily, let's try you again.
In the chat, Lily wrote that her microphone does not work, and she was wondering when she could, when an individual can be eligible for survivor benefits, Social Security survivor benefits, and the answer to that question is at age 60 or as young as age 50 if you are disabled, or younger than that if you're taking care of the individual's children who are younger than age 16 or the adult children who have a disabling condition. But the short answer is age 60.
Okay, hopefully that answered her question. That we're going to close out and have a great weekend. And if I don't hear from you or see you in the coming week, have a wonderful holiday.
Bye. Thank
I
you
want to
very
thank
much.
all of our presenters so much once again for coming on and presenting your information so succinctly and so completely understandable for the group. So again, thank you so much to all of you.